You already feel it. Groceries cost more. Rent keeps going up. Your paycheck buys less every single month. You are not imagining it. But here is the part nobody is talking about. The people who figured that out first are not complaining about it. They are not posting about it. They are quietly doing something about it. Something permanent. And the number doing it just hit a record high. Who are they? Keep watching, because the answer is not what you expect. Something is happening in this country right now that the people running it are not tracking. Not because they missed it, because tracking it would require them to explain it. The people leaving are not who you think. Not the struggling, not the broke, not the people with nothing left to hold on to. The people leaving are engineers with six-figure salaries, pediatricians, software architects, couples with careers and kids and mortgages, people who by every measure were winning at this. And they are gone. Not on vacation, not taking a break. Gone. I want to start with one number, because everything that follows lands differently once you hold it. 21%. That is the share of Americans who told Gallup in their most recent annual survey that they would permanently leave the United States if they had the chance. 1 in 5 Americans. And here is the detail that makes this number even harder to brush off. It was not measured during a crisis. Not during a pandemic, a recession, or a political meltdown. It was measured during the holiday season, the time of year when people feel most connected to home, when the pull of family and tradition is at its strongest, when every emotional anchor you have is pulling you towards staying. And still, 1 in 5 said they would go. Now hold that number, because I am going to give you the next one. Among adults under 30, it jumps to 24%. Nearly 1 in 4 young Americans, people who have not even finished building their lives yet, have already concluded this is not the place they want to build them. That is where we are right now. And most people have absolutely no idea, because nobody has lined these numbers up in the same room at the same time. Until now. The IRS tracks the people who make it official. In 2024, nearly 5,000 Americans formally renounced their citizenship. And this is not something you do on an impulse. It requires an in-person appointment at an embassy, a fee of over $2,000, and the permanent legal severance from the country where most of them were born. 5,000 people looked at that process and said, still worth it. But here is the thing. Those 5,000 are just the ones who filed the paperwork. The United Nations estimates the full American diaspora living abroad now sits at close to 10 million people. 2 decades ago, that number was 6 million. The rate of growth has tripled. This is not drift. This is not a lifestyle trend. This is a directed movement of the country's most capable people, and it is accelerating. So the question that actually matters, the one nobody in power is asking out loud, is this: what do all these people know that the official story is not telling you? The answer is never just one thing. What is driving this exodus is a convergence. Multiple systems failing at the same time. Each one serious on its own. But stacked on top of each other, they form a pressure that the most mobile, most resourceful people are simply no longer willing to absorb. There are 5 of them. And by the time I walk you through all 5, you will understand exactly why the people who can leave are leaving and what it means for the rest of us who stay. Let us start with the one that touches every single family in this country, regardless of where they live or what they do. The Kaiser Family Foundation surveys employer health benefits every single year. Their most recent finding is this: the average annual premium for a family health insurance plan has now crossed $25,000 per year, before a single appointment, before a single prescription, before anything. That premium alone costs more than a full-time minimum wage worker earns in an entire year just for the right to have coverage. And since the year 2000, those premiums have risen 240%. Over that same period, median wages rose 54%, 240 versus 54. That is not a market inefficiency. That is a transfer, money moving out of working families and into insurance companies and hospital conglomerates year after year at a pace wages were never going to keep up with. But here is the part most people do not realize until they actually meet it. The premium is just the entry fee. After paying roughly $2,000 a month, the average family still faces a deductible of $3,500 of any actual medical care entirely out of pocket. Many plans run $6,000 or higher, so you are paying $2,000 a month for coverage that does not kick in until you have already spent $6,000 more. For any routine illness, any moderate injury, anything short of a full-blown catastrophe, you are essentially on your own. What does that produce in people's lives? The American Journal of Public Health has the answer. 2/3 of all personal bankruptcies in the United States are connected to medical debt. And here's the detail that really stings. The majority of people who went bankrupt had health insurance when they got sick. The Consumer Financial Protection Bureau confirmed that medical debt is now the single largest category of collections debt in this country. Bigger than credit cards, bigger than auto loans. Let me put a face on that. I spoke with a software architect in his early 40s. 3 years ago, he had what his employer called a comprehensive plan. He had a cardiac event, 3 days in the hospital. 6 weeks later, a bill arrived. After the insurance company processed its portion, his share was still over $22,000. He told me he sat at his kitchen table and read that document for nearly an hour. Not because the numbers were confusing, because they were perfectly clear. He said it felt less like a bill and more like a verdict. Within 4 months, he and his wife had gone remote, listed their house, and started the visa application for the Netherlands. He told me without any irony at all that after running the real numbers, the Netherlands was cheaper than staying. That man is not the exception. He is the pattern. A relocation consultant who works specifically with American healthcare professionals told me her client list has tripled in 2 years. The people calling her are nurses, physicians, physical therapists, radiologists. The very people the system depends on most. And they are not leaving because the work got too hard. They are leaving because of what it costs them to stay. She described a respiratory therapist from Denver, single father, 2 kids. He took a job in New Zealand at a nominally lower salary. But after universal health care for his whole family, the prospect of free university for his eldest, and rent that took 30% of his income instead of 60%, his actual standard of living improved substantially. She said that on his first check-in call after the move, he mentioned he had slept through the night. He said he had forgotten what that felt like. The Association of American Medical Colleges projects a shortage of up to 86,000 physicians by 2036. Nursing schools are graduating students into a profession where experienced practitioners are walking out faster than they can be replaced. We are not losing our medical workforce to retirement. We are losing it to a system that has made staying inside it economically and psychologically unsustainable. Take a breath here, because the next part is harder to sit with. If healthcare is the economic case for leaving, what I am about to tell you is the part that makes families stop deliberating and start actually packing. It involves children. The K-12 school shooting database tracks every incident of gunfire on school grounds, not just mass casualty events. Every discharge, every weapon on campus, every shot fired. In both 2023 and 2024, that database recorded over 400 incidents per year, more than one for every single school day. No other wealthy country on earth produces numbers anywhere close to this. More than 95% of American public schools now run active shooter drills. Children as young as 4 years old are being taught to be completely silent, to hide, to make themselves invisible so that a person with a gun cannot find them. The National Association of School Psychologists has documented that these drills cause real, measurable trauma in young children. Heightened anxiety, sleep problems, regressive behavior. We are deliberately traumatizing a generation of children. Not as an unfortunate side effect, as the actual policy, because it is considered the more practical solution. I spoke with a couple, a pediatric occupational therapist and an architect, both in their mid-30s, who described the moment that ended their debate about whether to leave. Their 6-year-old came home from school and spent close to an hour rearranging the furniture in his bedroom, When they asked what he was doing, he explained, calmly, matter-of-factly, that he was figuring out where to hide if someone came to his school. He had developed a theory about which corner of a room was hardest to see from the doorway. He was 6 years old, and he had built a tactical plan for surviving a mass shooting. His parents did not argue. They did not call the school board. They went to the living room, sat down and looked at each other for a long time. Within a week they had contacted a relocation firm. They are now in Denmark. Their son rides his bike to school. A Pew Research Center study found that 27% of parents with school-aged children named fear of violence as a primary reason for considering emigration. Among mothers of children under 10, some surveys push that number above 35%. This is not a political argument. These are exit surveys from parents who have already made their decision. Beyond the schools, something is also shifting in major cities, and the data is hard to ignore. Carjackings, organized retail theft, random violence on public transit. The National Retail Federation has documented retail crime at epidemic levels, with commercial corridors in Philadelphia, Chicago, and San Francisco effectively shutting down. The Council on Criminal Justice confirmed the homicide surge of 2020 reversed years of prior progress. Rates have come down since, but the psychological toll on residents has not. San Francisco's downtown office vacancy rate now exceeds 36%. Oracle, Hewlett-Packard Enterprise, and Tesla have all moved their headquarters out of state. California lost a congressional seat after the 2020 census, the first time in state history. Chicago's public schools are losing students as families leave. Portland's retail core has been largely gutted. These are not isolated stories. They are early data points in a cycle that has a name. Economists call it a doom loop. As the highest-earning, most mobile residents leave, the tax base shrinks. As the tax base shrinks, public services deteriorate. Schools, infrastructure, emergency response. As services deteriorate, even more residents leave. Each turn of the cycle feeds the next. And once it reaches a certain speed, it becomes very hard to reverse. San Francisco is in the early stages of this. The question that officials are not discussing openly is very simple. Which city is next? Have you or someone you know started looking at options outside the US? Drop it in the comments. I read every one. Now let us get into the economic foundation underneath all of this. Because the official version and the lived version have never been further apart. The Bureau of Labor Statistics reports headline unemployment at 4.2%. Politicians cite this constantly as proof the labor market is in good shape, but there is a broader measure, the U6 rate, which includes people working part-time who want full-time work and people who have essentially stopped looking. That number sits at 7.5%. Closer to reality, but still not the whole picture. The Ludwig Institute for Shared Economic Prosperity publishes something called the true rate of unemployment. It measures what they call functional economic inadequacy, people who are either out of work or earning below a living wage in their county. Their most recent figure is 24%, 1 in 4 working-age Americans, either without a job or working one that does not actually cover the cost of living where they are. That is roughly 40 million people. And they are not all low-skill workers. They include college graduates driving for gig apps, credentialed professionals in contingent positions with no benefits and a schedule texted to them Thursday night for the following week. People submitting applications into systems that send automated rejections before any human being ever reads their name. The American Staffing Association reports that contingent and temporary workers now number over 20 million, the highest ever recorded. You cannot build a life on that. Cannot qualify for a mortgage. Cannot reliably budget a month ahead. Then the layoffs hit. Challenger Gray and Christmas, the firm that tracks corporate job cut announcements, reported that American companies announced over 744,000 cuts in just the first half of 2025. That is 80% more than the same period the year before, the highest since 2020. And these are not low-wage retail jobs. They are in technology, financial services, media, and manufacturing. Intel, 12,000. Citigroup, 20,000 over 2 years. Ford and General Motors idling plants as demand dries up. The ratio of job openings to unemployed workers has dropped from 2 to 1 down below 1.2 to 1. The cushion that existed is gone. Jerome Powell went before Congress and described the labor market as being in a good place. Treasury officials called the U.S. economy the envy of the world. The Federal Reserve's own survey of consumer finances found that 37% of American adults could not cover an unexpected $400 expense without borrowing or selling something. That is not the envy of the world. That is a population living right at the edge of what it can handle. Here is why the official numbers keep missing what people actually feel every single week. The Bureau of Labor Statistics reports inflation at around 3%. But that figure is built using something called hedonic adjustments, crediting product quality improvements against price increases, and substitution assumptions that swap out things people can no longer afford for cheaper alternatives. Independent analysts applying the methodology used before 1980, which tracked the actual out-of-pocket cost of a fixed basket of goods, find the real rate of cost increases has been running closer to 10% annually for several years. People feel this every time they go to the grocery store. A typical basket for a family of 4, eggs, milk, bread, ground beef, basic produce, ran about $150 a week in 2020. That same basket today costs $250 or more, a 60+% increase in 4 years. Eggs are the clearest example. A dozen averaged around $1 in 2020. In many markets today, they run $4 to $7. The result of avian flu, supply chain pressure, and the pricing power of a very consolidated industry. The USDA's own wholesale data showed egg prices tripling in 2023. Retail prices followed. They never came back down. The industry calls this price stickiness. The more accurate word is extraction. Ground beef averaged $3.50 a pound in 2019. It now runs $5.50 and higher. The profit margins of the 4 dominant meat processing companies actually expanded during this same period. That is not supply and demand at work. That is market concentration operating without any meaningful constraint. If there is one economic failure that defines this moment more than any other, it is housing. The Case-Shiller National Home Price Index shows the median existing home in the United States now priced above $400,000. At current mortgage rates sitting around 7% on a 30-year fixed, a household needs an income well above $100,000 to comfortably afford that. Median household income in the United States is approximately $80,000. The math does not close. A young couple can run those numbers 100 times and get the same answer every single time. The National Association of Realtors Affordability Index has fallen to its lowest reading since the pre-financial crisis peak of 2006. First-time buyers have been effectively locked out of most major markets. Renting has not offered any real relief either. Zillow's Observed Rent Index shows national median rent up 33% since 2019. Institutional investors, large funds that bought single-family homes at scale during the pandemic years, now control more than 20% of the single-family rental market in fast-growing cities like Atlanta, Phoenix, and Charlotte. A Government Accountability Office report confirmed that rent increases for institutionally owned homes consistently outpace the rest of the market. The eviction data shows you exactly what follows from that. Princeton University's Eviction Lab reports that filings in major cities now exceed pre-pandemic levels by 20 to 40%. Homelessness hit a recorded high of over 770,000 people in a single night count in 2024, the highest since federal tracking started in 2007. And that count is widely acknowledged to be an undercount. Now add tariffs on top of all of that. The Yale Budget Lab calculated that the combined trade tariff structure adds approximately $2,300 per year in higher prices for the average American household. For larger families, closer to $3,000. Clothing projected to rise 25 to 35%. Electronics up $200 per device. Footwear tariffs adding roughly $50 to a basic pair of sneakers. The Alliance for Automotive Innovation estimates that tariffs on steel, aluminum, and finished vehicles could add $5,000 to the sticker price of a base model sedan, pushing monthly payments past $800 for millions of buyers. This cost lands almost entirely on middle and lower income households. Wealthier households spend proportionally more on assets and services that import tariffs largely pass right by. The families actually carrying this are the ones buying shoes for their kids and trying to replace an appliance that stopped working. So that is the full picture. Healthcare extraction, school safety failures, wage stagnation, a housing market closed to most buyers, grocery prices 60% higher than 4 years ago, and now a regressive consumption tax layered on top of all of it. These pressures do not arrive politely, one at a time. They arrive together. That is what makes the math so hard to escape. If this is helping things make sense, a like genuinely helps more people find this video. The relocation industry is where you see the verdict rendered in real time. A consultant who helps American professionals move to Central America told me that serious inquiries from the U.S. went from roughly 15 per week 2 years ago to over 80 per week today. She had to hire extra staff just to handle the volume. The profile of who is calling has completely shifted. It is no longer primarily retirees looking for warm weather. It is professionals in their 30s and 40s, dual-income households who have done the actual math and found that a nominally lower salary abroad, combined with universal health care and stable housing, produces a materially better life than what they have here. She described a radiologist who moved her family to Uruguay. On paper, her income fell. In practice, healthcare costs went to zero. Housing dropped by half. Her kids are in a well-funded public school. She told the consultant that on her first Saturday after arriving, she went to the market with her kids and bought groceries without calculating what she could afford. She said it was the first time she had done that in 11 years. The Association of Americans Resident Overseas reports its membership has doubled in 3 years. Destination countries include Portugal, Spain, Scotland, New Zealand, Uruguay, Panama, Malaysia, and Colombia. These are not people all headed to the same beach. They are people choosing different systems that treat medical care as a service, housing as a basic need, and public safety as something the government is actually supposed to provide. International relocation platforms are reporting American traffic up over 300% in 2 years. These are not casual browsers. They are people researching visa categories and tax treaties and school enrollment timelines. Here is the second-order consequence that almost no reporting addresses. The people leaving are disproportionately the highest earners, the most educated, the most entrepreneurially productive. They pay the most in taxes. They start the businesses that employ other people. They fund school districts through property taxes. When they leave, they do not just take their skills, they take their economic contribution with them. And the people with the fewest options, the elderly, the disabled, those without savings or internationally transferable credentials, they are the ones left behind to absorb the consequences. This is the doom loop playing out at national scale. Productive residents leave, the tax base shrinks. A smaller tax base funds worse services. Worse services push more people to leave. Each rotation is faster than the last, and it does not stop on its own. The human cost of sustained pressure at this scale is now showing up in the CDC data. Drug overdose deaths, down from a 2023 peak of over 110,000, still claimed approximately 80,000 lives in the most recent 12-month period. Suicide claimed 49,000 more. Alcohol-related deaths account for roughly 70,000 per year. Researchers who study what they call deaths of despair, deaths rooted in hopelessness, economic dislocation, and the collapse of a reason to keep going, estimate those causes are collectively killing close to 200,000 Americans every single year. The suicide rate among people aged 10 to 24 has risen 56% over the past decade. The American Psychological Association's annual stress survey found that 76% of adults named the future of the nation as a significant source of stress in their life. 66% named the political climate specifically. Chronic psychological stress is not just uncomfortable. It has documented physiological consequences: cardiovascular, immune, metabolic. A society running at this level of sustained tension is not a healthy society. The deaths of despair data confirms exactly that. Now I want to say the thing that most analysis carefully stops short of. The people leaving are not making an emotional choice. They are making an arithmetic one. A nurse who moves to Scotland for lower nominal pay but gets universal healthcare, stable housing, and no administrative battle with insurers is making a financially rational decision. A family that relocates and watches their child stop rehearsing survival plans in his bedroom is making a psychologically rational decision. A physician who can no longer function inside a system designed to extract money from sick people at their most vulnerable moment is making a professionally rational decision. These are not the choices of scared people. They are the choices of informed people who have run the numbers and found that the balance no longer holds. The social contract that built the American middle class, broad-based economic growth, accessible housing, affordable healthcare, institutions that actually worked, a real path upward for people willing to put in the effort, was not dismantled by accident. It was taken apart through specific, documentable decisions made over 40 years. The weakening of labor power, trade agreements that sent manufacturing overseas, regulatory agencies captured by the industries they were supposed to police, a central bank that consistently used its tools to inflate asset prices at the expense of wages, the $70 trillion in unfunded federal liabilities, Social Security, Medicare, commitments made with no current funding mechanism, resolve in one of two ways: broken promises, or inflation that slowly erodes the value of the currency used to honor them. There is no version of that math that does not cause serious pain for the people depending on those systems. And this is not a partisan point. Both parties built these conditions at different times in different ways. The people leaving are not making a statement about either one. They are making a statement about outcomes. They are looking at what the country actually delivers in healthcare, in housing, in safety, in wages, in the texture of ordinary daily life, and concluding that the gap between what was promised and what is actually happening is no longer something they are willing to carry. So what does all of this actually mean for you? The people leaving right now are the early movers. They have the resources and the awareness to recognize the trajectory before it reaches their own front door. The majority of this exodus has not happened yet. As these pressures continue compounding, healthcare cost rising, wages stagnating, housing locked, tariffs layering on, the volume of people leaving will increase. That is not a pessimistic view. It is a pattern that has appeared in every prior case of a developed society entering structural decline. The misery index, inflation plus unemployment, currently sits at levels that have historically preceded recession. The Conference Board's Consumer Confidence Index has fallen sharply, and its forward-looking component, the part that captures what people actually expect the next several months to bring, has dropped below the threshold that preceded every recession since 1980. The stock market gets cited constantly as proof of economic health, but the top 10% of households own 93% of all equities. The bottom 50% own less than 1%. A record market is meaningful data for a very narrow group of people. For everyone else, the honest economic indicator is the grocery receipt, the rent bill, the explanation of benefits, the job listing that sent an automated rejection before any human being read the application. The exodus is the population registering its honest assessment of those metrics in the most permanent way available to it. What comes next is not inevitable. Doom loops can be interrupted, but doing that requires naming what is actually happening. Without the spin, without cherry-picked statistics, without metrics designed to tell a reassuring story rather than an accurate one. The data is in. People are voting with their passports. That vote is permanent. It is compounding, and the question that has not been answered yet is how large it needs to become before the systems left behind can no longer maintain the story that everything is fine. That question does not have a comfortable answer, but it has an honest one. And right now, honesty is the only thing in this country that has not been adjusted, hedged, or managed away. What do you think comes next? And are you making any plans of your own? Tell me below.